Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question asks, what is the most effective treatment for ADHD, Attention Deficit Hyperactivity Disorder? And typically when I receive this type of question, it's framed as kind of a competition between counseling and psychiatry. So quickly I'll explain the differences between these two professions. We see that counselors use talk therapy to try to treat the symptoms of mental disorders. So the kind of classic 50-minute counseling session, one-on-one with a counselor. And psychiatrists are medical doctors. They're physicians. They prescribe medications and typically do not provide counseling. So because I'm talking about the differences here between these professions, it's important to indicate that I am a counselor, technically a counselor educator, so I'm a licensed professional counselor. I'm not a physician, not a psychiatrist. So the prevalence of ADHD has increased from around 3 to 4% to around 7 to 10% of the population in the United States. And during the same time period, in the last few years, we've seen the prevalence has not increased in the rest of the world. So there's this concern that ADHD is being misdiagnosed, or there may be an epidemic of ADHD. Either way, there's a lot of concern over how to treat this disorder. And this disorder is somewhat misunderstood. Technically, somebody can't have just ADHD. It has subtypes. And the way a subtype works is somebody has to be in one of those types. So they're mutually exclusive and jointly exhaustive. So if we look at the three subtypes, we see there's the inattentive subtype, the hyperactive impulsive subtype, and there's a combination of both of those. So if somebody has ADHD, that diagnosis is in one of those three categories. There is no ADHD with nothing after it. There has to be some sort of subtype. Now we see that 50 to 80% of those diagnosed with ADHD meet the criteria for at least one other mental disorder. This is called comorbidity. And some of the common comorbid mental disorders would be obsessive-compulsive disorder, major depressive disorder, bipolar disorder, autism spectrum disorder, and conduct disorder. Now, ADHD is often misdiagnosed, and this gets a little tricky because I'm comparing counseling to psychiatry here. And when we use the word misdiagnosed, a lot of times we think of the words overdiagnosed and underdiagnosed. And the reason this is tricky is because the term overdiagnosed means something different to a counselor as compared to a psychiatrist. So in the world of medicine, overdiagnosing actually means overtreating. So it's detecting symptoms and providing treatment when if you left it alone, it would probably work out okay anyhow. Right? That's what overdiagnosing is in the world of medicine. In the world of counseling, overdiagnosing is a false positive. So a diagnosis of ADHD was given to somebody when the disorder wasn't actually there. Now, underdiagnosing is a false negative. So this means there was no diagnosis of ADHD given, but it really should have been given because the person technically met the full criteria for the disorder. So we see here that research supports that overdiagnosing, in the way that counselors use the word, is a significant problem when it comes to ADHD. That there are too many false positives. Now, there's some false negatives too, of course, but there's too many false positives when it comes to ADHD as we compare ADHD to other mental disorders. Now, we also see some other interesting information around this topic. We see the study around immaturity that I find fairly fascinating. Children born just after the cutoff date for a particular academic year group, so these would be children that would be older when they first went to school. This group is 25% less likely to be diagnosed with ADHD than children born just before the cutoff date, so children that would be younger when they first went to school. So we're talking about a matter of days up to several weeks. And that's really an amazing difference with this 25% less likely to be diagnosed piece. So it really suggests that clinicians are diagnosing ADHD when they should be just looking at somebody and saying they're immature. So this is a significant problem when it comes to ADHD. We also see a lot of misinformation about who ADHD affects. A lot of the times when we think of ADHD, we think of children, right? A lot of children would be diagnosed with ADHD, but a lot of adults would not be. But around 40% of children with ADHD will continue to meet the full diagnostic criteria for the disorder into adulthood. Another 20% will report partial symptoms of ADHD when they move into adulthood. Other research actually shows higher percentages in this area. For example, we see a study that says that 85% of children with ADHD will continue to have it into adulthood. Now, ADHD expresses itself a little bit different in adulthood. 90% of adults with ADHD have inattention as the prominent clinical feature. So the symptoms of hyperactivity and impulsivity, which are common in children with ADHD, tend to dissipate as an individual reaches young adulthood. It's also thought that ADHD is underdiagnosed in adults. So again, a false negative would be more likely than we would like to see, more likely than we see with other disorders. On top of all this, we see this theory out there that ADHD might not exist at all. Now, I disagree with this, but I want to mention this theory because I think it's important to this question. We see this theory that ADHD is actually a collection of symptoms from other disorders, like the ones that are highly comorbid with ADHD. I talked about some of these before: OCD, MDD, bipolar disorder. But they also look at some symptoms from other conditions in this as well, like sleep disturbance, substance use, learning disabilities, hearing loss, and vision problems. So what they're really saying is there's a collection of symptoms from all these other disorders and conditions. This collection comes together and we call it ADHD, but we really shouldn't because ADHD doesn't exist. Again, it's just all these other symptoms. This is certainly an interesting idea, but I think we can really think of every disorder as a collection of symptoms from other disorders. We could take a disorder that's very well established in the research literature as being real, like bipolar disorder, and say, well, bipolar disorder just contains symptoms from borderline personality disorder, intermittent explosive disorder, OCD, major depressive disorder, and other disorders, right? We know that doesn't really make sense. We know that bipolar disorder is distinct. So it's just a tough argument to make with bipolar disorder, and I think it's also a tough argument to make with ADHD, because in my clinical experience, and of course this is supported in the research literature, ADHD does present as distinct. It's a real disorder. I don't think that's really at issue here. It does actually exist. So operating under the assumption that ADHD is real, what about the treatment? What about counseling versus psychiatry? Well, many people actually believe that medication, in order to treat ADHD, is an undesirable route, but at least it's a successful route. That's kind of the common thinking. This is among the general population, but also among clinicians, including counselors. But actually, there's no clear effective treatment that's been identified for ADHD in children, and in terms of ADHD in adults, it's even less clear about how we treat ADHD. What we see is that there are definitely gains experienced from medications, in many cases anyway, like better attention in the classroom, better impulse control, and better academic performance. Often these gains are quite pronounced in the short term. They're very noticeable in the short run, which leads people to believe that medications are a highly effective treatment. Well, this is interesting to contemplate. First, 30% of individuals with ADHD will not respond to medication at all. So they won't even get that dramatic short-term benefit that we do see in the other 70%. Second, for many, the treatment is not durable. This means that the gains, the improvements, are not maintained in the long run. Now, when we look at behavior therapy and we mix that with medication, and this is fairly common, we see that this combination tends to work a little better. But still, the symptoms do not go away completely. They tend to return in about a year, sometimes less than a year. And after the termination of this combined therapy, the symptoms return to premorbid levels. So what this means is the symptoms return to the same frequency, duration, severity that we saw before treatment started in the first place. So before the person received any type of treatment. Now, comparing behavior therapy and medication, again I'll call this combined treatment, to behavior therapy alone, we see some interesting results. The combined treatment group experiences more improvement initially than behavior therapy alone, but after a few months, some of those gains are lost, and the improvement becomes similar to what we see in the group that only received behavior therapy. So some may hear this and think, well, that's okay, it's not really a big problem because most people with ADHD would be getting treatment from both a counselor and a psychiatrist. Well, in terms of children with ADHD, we see that 75% receive medication-based therapy. Less than half of those receive counseling services. We also see there is a quality of evidence problem when we look at the effectiveness of medication. There are many studies that show that medications are effective for ADHD, but many of these studies refer to low-quality evidence. They cite low-quality evidence, and they tend to have a potential influence from bias that, again, exceeds what we would normally expect in the research literature. On top of this, medication for ADHD can lead to depression in later life. We see some studies that indicate this. And, of course, there are a number of side effects with medication. Now, how much medication is being used is also a problem. The use has increased dramatically over the last few years. We saw this study that looked at this issue from the year 2000 to 2010, and they saw a 46% increase in ADHD medication use. We see another study that ran from 2010 to 2014 that looked at how many calls were directed to U.S. poison control centers that involved exposure to ADHD medication among people who were age 19 or younger. And what we see here is that there were 29 calls per day on average during these 4 years, and the number of calls increased over the duration of the study. They increased by 61%. So it appears there are a lot of problems with the medications used to treat ADHD, but does this matter if there's no alternative? And this is where we have to look at counseling as a potentially viable alternative in many situations. Many counseling modalities are actually available for ADHD. I mentioned behavior therapy, but also cognitive behavior therapy, and even psychodynamic therapies have been shown to be reasonably effective. Cognitive behavior therapy, CBT, though, is by far the most popular in this area in treating ADHD. And we see a few different steps in CBT for ADHD. Education about the disorder and also training in a number of areas like problem solving, attention management, behavioral management, social skills, and anger management. The problem here, though, is we don't have a lot of research on the effectiveness of counseling for treating ADHD. We have some research, but not a lot. We do know that counseling comes with very few side effects, and that makes it quite different than medication, but counseling isn't free of side effects altogether, which may seem a bit surprising, but counseling does come with some risks. So as we can see, the area of treatment is kind of tricky, and unfortunately there is no clear answer here in terms of what the best route is. In general, I think it does make sense to give counseling a try, to go to a counselor and see if that can help resolve some of the symptoms or all the symptoms with ADHD. But then we see some other studies that indicate that intervening early with medication actually seems to make sense too. I think a lot of this question actually comes down to assessment, whether we're talking about counseling or psychiatry. Not just the initial assessment. We know, again, that ADHD is often misdiagnosed. I think one of the larger problems in addition to this is actually ongoing assessment. It's the reassessment that doesn't seem to be happening. There's a tendency in mental health treatment to give a diagnosis and stick with that diagnosis forever. Clinicians are reluctant to challenge clinicians that have seen a client before and given a diagnosis. But effective mental health treatment actually involves frequent assessments. Assessment is really an ongoing process. It never stops. It's not something that happens just in the beginning and then we see only treatment. We should see assessment the whole time. If a mistake is made and the wrong diagnosis is given, that's unfortunate and we need to avoid that, but the mistake is only compounded if clinicians don't continually assess clients. I think what happens here a good deal of the time is that people get frustrated because the treatment is not working. They say, my child is not responding to treatment, I'm not responding to treatment, when the whole time along the diagnosis was actually incorrect. So treatment typically is not going to be effective unless it's treatment designed for the diagnosis that's actually there. Now sometimes, of course, treatments can work for different diagnoses. But generally, of course, we want the correct diagnosis so we can find the best treatment. I know whenever I talk about topics like ADHD and treatment, there'll be a variety of opinions, people who agree with me and disagree with me, and who have other thoughts based on their own experiences with ADHD, or perhaps they know somebody with ADHD. Please put those opinions and thoughts in the comment section. They always generate a really interesting dialogue. As always, I hope you found this description of ADHD and treatment modalities to be interesting. Thanks for watching.